Good afternoon, everyone. Thank you so much for joining us on this beautiful Thursday afternoon. We're looking forward to the presentation. It's my pleasure to introduce our speaker for our webinar this afternoon, Mary Rose Corrigan. Mary Rose Corrigan has worked for the City of Dubuque Health Department since 1985 and in her current role as Public Health Specialist since 1989. She's been involved in the delivery of many health programs and services, along with initiating many new programs and policies, including childhood lead poisoning prevention and the Crescent Community Health Center. Since 2001, she's been involved with the community emergency preparedness education and planning, including pandemic influenza planning. She serves on several community-based organization boards and also hosts nursing and public health students for public health experience and internships. She received her BSN from Mount Mercy College and her MSN from Clarke College University, or Clarke University, right here in Dubuque. We are so pleased and honored to be joined today by Mary Rose. Mary Rose Corrigan, I'm going to turn it over to you so that we can get started.
Great, thanks Molly and the Chamber for providing this opportunity to share some information and try to make it easy for everybody to understand all these COVID isolation and rules and terms and all those things. So I'm going to give a presentation today, and as you know, you can submit questions via the chat box and we'll answer them at the end. So I do want to say that this whole time since March, I've been operating in conjunction with the Dubuque County Public Health Incident Management Team. And that includes Patrice Lambert. She's the director of the Dubuque County Health Department. Stacy Killian, she's the Dubuque Visiting Nurse Association director. And Tom Berger, who's the Dubuque County Emergency Management Agency director. And both Stacy and Patrice are on the webinar today, and they'll also be available for questions at the end or to help with any clarifications we have. So I'm going to just do some real basic topics today. I'm going to talk about contact tracing, isolation and quarantine and what the difference is. A little bit about critical infrastructure employees. I want to give you some key resources because you're not going to remember all this and you need something to refer back to. We'll talk a little bit about testing and maybe what as best as we can tell, what the future looks like. So first of all, we hear a lot about COVID-19 investigation and contact tracing from our public health professionals. And when we first started in March, our local VNA staff was conducting the contact tracing. And this is something that the VNA always does for us in our county as part of being our public health nursing arm. All communicable diseases, Iowa has a big list of reportable communicable diseases. And on those communicable diseases, many of them require contact investigation. So since March, COVID-19 was named a reportable disease that has to be reported and is now amongst this list that requires contact tracing. So anytime a doctor's office or a lab submits a test for COVID-19, it gets reported, and it gets reported as negative or positive. And that's definitely been a big help in us tracking this pandemic and knowing what's going on in the community. So all those cases are reported, and the public health professionals follow up with those. So a case investigation now occurs by the Iowa Department of Public Health. It was, I believe, sometime in May that the VNA, the cases became a little bit more than our local staff could handle. And not to mention, we needed our public health nurses for other things like testing and working with our long-term care facilities and just helping out with community education and a lot of things. So Iowa Department of Public Health has a variety of people, including the National Guard and moving into DHS workers and Iowa Department of Public Health staff that are doing contact tracing. And it involves contacting the positive COVID case, getting a lot of information about their symptoms, when they became sick or if they became sick, and then of course who they've come in contact with, and then that in turn provides a notification for those direct exposures. And obviously the reason that is because we want to prevent the spread of the disease, and if we can get in touch with those directly exposed people, we can educate them on what they need to do to prevent the spread. Just as a reminder, we define a contact or a direct exposed person as somebody within 6 feet of another person for 15 minutes or more. That's kind of the golden standard. So with that, we provide isolation education, and that includes the 10-1 and symptoms improved rule, and I'll go over that in a minute, and the quarantine education for those people that are exposed. And it also, even though our VNA is not doing the direct contact tracing, every positive case gets contacted by the VNA with an initial contact, notifying them of the results and making sure they have the initial information they need to be safe and start to protect those around them before the contact tracers can contact them. Also, the VNA has been great this whole time. They have served as our public call-in center for just general public questions regarding COVID-19, information, exposure. And that number is open all the time. It's not live all the time, but if you leave a message, they will get back to you. So I'm going to be sending this PowerPoint out to the chamber staff, and they'll share it with you, so you'll have that phone number. But that's available to anybody. The VNA has also been providing a lot of assistance to work sites, and many of you may have had their assistance. So let's talk about isolation and quarantine and what's the difference. Isolation or isolate means something you do when you are sick. You're either you have tested positive and or you have symptoms of COVID. Now I listed the COVID symptoms on here. The most prominent ones, or at least for the first month or two, we talked about fever, chills, cough, and shortness of breath or difficulty breathing. And as time has gone on, through our research and all the data we've been gathering through contact tracing, the list has been added to as potential symptoms of COVID-19. And one of the distinct ones is a new loss of taste or smell. Other things include fatigue and muscle aches, headache, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. And I think the thing that makes COVID-19 sometimes difficult to sort through is these symptoms are also symptoms of many other illnesses we can get. And so sometimes it's hard to decipher whether or not it's COVID. You may have to decipher that through testing or, assessing if you've been around somebody that you know was positive or symptomatic, or if you were in a situation that put you at risk to be around others like that. So if you test positive or you have these symptoms, you need to separate yourself from others. And what that means is you have to, you cannot be around others for 10 days. So 10 days from the onset of symptoms or from the day you tested positive, whichever is first. You have to go through 10 days. You have to be at least 24 hours with no fever. And that includes without the use of fever-reducing medications such as Tylenol and ibuprofen. And your symptoms have to be improved. So there's 3 things that allow you to complete isolation and let you be around others. 10 days since symptoms first appeared or you had the positive test, and at least 24 hours with no fever-reducing medications, fever-free, and your symptoms are improved. So that's what we refer to as the 10-1 and symptoms improved rule. Now, many of you may be thinking, I thought this was 72 hours without a fever. Well, up until a week or so ago, it was. And the CDC, the Center for Disease Control, changed their guidance to 24 hours. And again, that's based on all the data coming in, research, the data from the contact tracing, and learning more about communicability of the disease. So remember, isolate if you are sick. Now, how does that compare with quarantine? Quarantine means it's something you need to do if you are exposed. So remember, exposure, or if you are a close contact, means that you are within 6 feet of someone who has COVID-19 for at least 15 minutes, or they had the symptoms of COVID-19. Some of the other things that close contact includes that if you provide care at home to someone who's sick with COVID-19, you had direct physical contact with a person, such as touching, hugging, kissing them. You shared eating or drinking utensils with the positive case, or they sneezed, cough, or somehow got respiratory droplets on you. And I kind of call that the direct hit. Unfortunately, if someone wasn't wearing a mask or coughed or sneezed directly on you. So that's what we count as a close contact or exposure. So what do you have to do if you're exposed? Well, you have to stay home for 14 days from your last contact with the person who has COVID-19. And during that time, you have to watch for fever, cough, shortness of breath, or all those other symptoms of COVID-19, and stay away from others, especially those people who are at higher risk for getting, very sick with COVID-19. And that includes elderly, people with underlying health conditions, all of those things. Now, it's kind of confusing because you think, well, how come the person who is sick only has to stay at home for 10 days and the person who's just exposed has to stay at home for 14 days? It almost seems backwards. Well, that's because the incubation period for COVID-19 is 2 to 14 days. And incubation period means the time from which you are exposed or get the virus into your body until you develop symptoms or test positive can take up to 14 days. So I'm going to show you a little example here. And this is one of my favorite websites. I'm going to give you this link. But this is a Center for Disease Control. And just a little side note about the Iowa Department of Public Health and the CDC websites. There is a lot of information on there. And if any of you have gone on there, you know that it doesn't take long and suddenly you're like 8 or 10 links deep and you forgot where you started. So I'm going to provide you at the end in the slides with some links of the websites I use most frequently and I think are the most user-friendly for the public. So this one is under the heading, if you are sick, and quarantine if you might be sick. And it talks about the close contact I mentioned, that you have to stay at home for 14 days and watch for the symptoms. But it also gives some examples of when to start and end quarantine. So if we look at the first example, it says close contact with someone who has COVID-19, and you won't have further close contact. So let's say you had close contact, you had an exposure on July 1st. You count 14 days from that day, and that's the last day of your quarantine period. So it's basically 2 weeks from the day you were exposed. As long as you don't develop symptoms, then you're golden and you can get out of quarantine on this day. So let's say that you have close contact with someone who has COVID-19, like you live with that first person, but you're able to isolate within your home. You got separate basement, bathroom, you never come upstairs, kind of like Chris Cuomo did early on when he was broadcasting from his basement on CNN. So you start on day 1, you separate yourself from everybody in the household, and you're done after that 14 days. But what if you live with someone who has COVID-19 and you can't avoid continued close contact? Let's say you have a spouse, an elderly parent, or a child that it isn't practical for them, or your home doesn't allow distancing or separation of quarters. So let's say the person gets sick on the 30th of the month. So because they're sick, they're going to be isolating for 10 days, right? So here's this 10 days. Quarantine begins on the last day of exposure to a positive case. So on their 10th day starts your 14-day quarantine period. So that adds 2 weeks that you have to stay at home. It's kind of an unfortunate situation, and many people get confused about this, particularly when there was young adults living at home that had COVID, or you know, it may have a big impact on us as if and when we see more children. But this can be a long time, you know, if you can't separate within your home, that you'll have to remain in quarantine. And that's also a tough thing for employers too, to accommodate employees that way. So this website gives some good examples, and if you read through them, it really kind of spells it out in easy language, and it's visual. So let's talk a little bit about testing for SARS. And the official, SARS-CoV-2. SARS-CoV-2 is like the official name for COVID-19. And remember that it's part of the coronavirus family that includes SARS that we had and MERS in the last 10 or 15 years. And this is the third big one causing a pandemic. So we have viral testing or PCR testing. And that is going to tell you if you're currently infected and you can currently spread it to others, and there's a good chance you're going to be sick. Antibody testing or serology testing is when they look for antibodies to the COVID-19 virus. We produce antibodies as a way our immune system fights off disease, and so those antibodies will show up in your body, in your blood, basically, and show that you've had the disease or been exposed enough for your body to react to it. Now, the thing about antibody testing is usually antibodies are associated with some type of immunity or the ability to continue to fight off the new virus. We really don't know how long or if any immunity comes from having this disease. That's still being researched. So just because you had a positive antibody test doesn't mean you can't get COVID-19 again. Or if you had an exposure to someone with COVID-19, you would have to isolate again. So the antibody test is a nice way of knowing if you weren't sure if you had the virus, you want to know. It's your healthcare provider can order it, or you can just go to the lab and pay for it. It's pretty inexpensive, and it's a venous blood draw. Now, in our community, pretty much all the healthcare providers, the clinics, the hospitals, doctors' offices are providing testing. The doctor's offices focus more on people at risk, people with symptoms, people with underlying health conditions that puts them at greater risk for COVID-19. And then we also have our Test Iowa site that you can sign up for at testiowa.com, and this is a free test that's open to anyone regardless of exposure or symptoms. Our Test Iowa site in Dubuque at Epic Health and Wellness has recently modified their hours and scheduling. They are now doing appointments, but they will continue Monday through Friday. And so you just need to call them and set an appointment. And the nurse at Epic Health and Wellness asks that anyone who calls and has to leave a message, they will call you back. There's no need to leave multiple messages for the Test Iowa. And also, anybody in the state can go to any Test Iowa site throughout the state. Now, the important point as an employer is, and this is one I really want to make clear, is that negative test results should not be required for a return to work. So if you have an employee that's been out because they were symptomatic and they were isolating appropriately, or because they tested positive, what you should require is either the 10-1 rule, that they were off for those 10 days, their symptoms improved, and they haven't had a fever for 24 hours, or if they were in that 14-day quarantine period, that they complete those. The reason we cannot or should not require a negative test is because this viral test, this PCR test, is very sensitive. And it will pick up that virus, the RNA from that virus, for possibly months after you've had the disease, even though you may not be infectious to others. So you may continue to test positive, have completed your isolation, are completely healed, and are not contagious to others, but you may still test positive. So we do not recommend requiring a negative test to return to work. The other thing about testing is, if you have an exposure, you're around a positive person, and you're concerned you might have COVID, you should also always wait a couple days to get tested, because it may take that long for the virus to show up in your body. Remember, it's 2 to 14 days that it could take. So the date of the test and you get it negative is for that date. You may end up testing positive 7 days out. That's why we require that 14-day quarantine period, regardless of test results. So testing is a tool, it's a thing we need, but we also have to pay close attention to isolation and quarantine. So just a little bit, real basic best practices, and I know a lot of businesses have, done a lot of planning and made accommodations and all of these kinds of things for the work site, but these are real basic. First of all, I'm not a human resources expert. That's a whole nother session on all the employment requirements and payment requirements. I'm not an expert on that. But I do know that it's always best practice is to have policies that encourage sick employees to stay home and seek medical attention if needed. So whatever the disease is, whether it's influenza or the stomach flu or whatever, if you have a policy that allows people to be sick and stay home so that they don't come to work and spread it to others, that's going to help you in the long run. Another thing you may not think about is, it doesn't happen always, but what if a person, while they're at work, becomes ill and they have symptoms of COVID, and let's say they can't drive themselves home or to the hospital, you should probably think ahead about what you would do in that case. If a person suddenly has difficulty breathing and they break out in a fever, that's kind of a sign that that might be COVID. So you want to plan for, do we call 911? Do we call just medical transport service, which we have a couple of those in Dubuque, which is another option? Do we have another way? Do we have a list of family members we can call if people have an emergency, those kinds of things. So think about making a plan for that. And if possible, plans for employees to continue to work. I should have put from home there, excuse me, or telework. If they're under quarantine or symptomatic but not, ill enough to not do some work at home. Not every work site has that ability. And that, I know I said I was going to talk a little bit about critical infrastructure employees. I'm sure many of you have those employees as defined by the state and federal, and it includes law enforcement, it includes construction workers, critical people to keep facilities and the community going. They have a few different rules for exposures. I encourage you to look those up. That's also where you can make plans for employees to continue to work if they're exposed, but remain asymptomatic if they're a critical infrastructure worker. Of course, you want to have staff backup plans and redundancies. Earlier on in the pandemic, the state was encouraging reporting of 10% increases in absenteeism at work sites. That's definitely optional, and if you are experiencing an unusual amount of absenteeism due to COVID, or you're not sure it's COVID, and you want some additional guidance, our VNA is available to help with that, and possibly work on getting you some targeted testing, those kinds of things. So it's optional, but the VNA is there to help, or any of us for that matter, if your work site is experiencing increased absenteeism. And of course, it's always good to have consistency in where people work, the equipment they're using, all those kinds of things, because if a person does show up positive or symptomatic, it will be easier to figure out who their close contacts were. If they're always at the same workstation or doing the same thing, it'll be much easier to track that down. We've all been cleaning and sanitizing more. That's going to help us with not only COVID, but a lot of illnesses. And at the work site, if you are coming into a physical workspace, physical and social distancing. I know many work sites require masks when you're not in your own office or space. That is good practice. And then think about employee guidance for when they're outside the workplace. What are your expectations of your employees? I think it's good to set expectations about employees not putting themselves in situations that are risky, that could possibly expose them to the virus. So encourage them or require them not to do those kinds of things. So a little bit about travel, and here's what I'll start to show you a few of my favorite links. First of all, that first bullet I already spoke to, that, what will you do if you have ill people? You need to plan for how to transport them. The CDC also has international and domestic travel updates that are good. It's really hard to plan travel these days, but I think it's a good idea to look at these sites, see what you're getting into, see what the requirements are, see what the community spread is. Another one of my favorite sites is this bottom one here. What's new? The changing guidance. Remember how I said a couple weeks ago they changed the requirement for isolation from 72 hours fever-free to 24 hours. Well, that's where they post it. It takes a while for the word to get out, for the media to pick up on it. They don't send out an email alert to any of us public health people or healthcare people. They just throw it on there. So this page has all the new changing guidance, and it puts a date by it, so it's pretty easy to go through. And I can probably go to that real quick here. It's another one of my bookmarks. So what's new? And you'll see that today they did some CMS guidelines that involves Medicare and Medicaid. Yeah, you probably don't need to read that one. Data on pregnancy. This one's always a good one. It gives the cases and deaths by county. Tips on living in shared housing. So some of them are going to apply to work sites, some of them are not. Cruise ship member disembarkation, seems like there's always changes to those recommendations, but you can look at them real quick and see if there's anything pertaining to the website for those situations. And then these are the links for the isolation and quarantine pages, the what's new, and the business workplace. Again, I'm sending these out so you'll have them. You don't have to write them down real quick. The business and workplace guidance on the CDC, it's kind of, there's a lot to it. After a while, you may get good at kind of zeroing in on your specific type of work site, whether it's office or manufacturing or different things, whether you're a community-based organization, those kind of things, and you'll learn where to go. And then, of course, the Iowa Department of Public Health, they have a business and organizations link. Some of those of their resources go straight to the CDC, but there is some Iowa-specific things. And for local data and statistics, including Dubuque County data, that is the coronavirusiowa.gov website, and there's the travel. I also included our incident management team emails. We're happy to help work sites. It's best to email us versus trying to call us. For one thing, half the time we're on a webinar, a Zoom meeting, and sometimes if one of us gets posed a question, we may have to bounce it off each other to give the best answer or the best option. So that's the best way to reach us. So that's all the prepared remarks I have, and I'd be happy to open it up. Oh, I have one more slide. Oh, I was going to talk about yeah, the future. I didn't make a slide for that, but I will say that you know, it's become kind of obvious that this thing isn't going to be over real soon. Summer didn't derail it, and the spread is stronger than ever. So we need to be making some long-term plans. And although progress is being made on a vaccine, we can't really count on that. That has a long ways to go. And those of us in public health know that when we do get a vaccine, it's going to have to be manufactured. And we got a lot of people in this world to cover with that. So everybody won't have the vaccine instantly. What we do need to think about is this fall, you know, as COVID-19 kind of intersects with influenza season, it's going to be more important than ever to get your flu shot. And, you know, as time goes on and we gather more data and all the really smart people do more research, it's going to tell us more specifics about symptoms, treatment, our immunity, antibodies, best practices for schools and businesses, and all of those things. So the guidance is going to continue to change, and we're going to find out new information. So now I think we're ready.
All right, Mary Rose. First question I have is, does the exposure plus 6 feet for 15 minutes or more rule apply if both parties are wearing masks?
Masks do not rule that out. So even if you're wearing a mask and you have that exposure within 15 minutes or for 15 minutes within 6 feet of a positive or symptomatic, you still have to quarantine. Now, masks are really important. We're still learning about the effectiveness of masks, but we know that they do diminish the droplet spread from sneezes and coughs and from just plain old talking. So we strongly encourage wearing of masks. Masks protect others from getting infected from you. It doesn't necessarily protect you from others. So that's why it's important we all wear them. But yeah, unfortunately, masks don't factor into the exposure.
Next question, and you covered travel a little bit, but if someone is returning from the US from international travel, they've heard that it's 10 days and 14 days. Does the international travel timeline change things?
I would have to look at the guidance for that. Does Teresa or Stacy know the answer to that? I would think that there are specific countries of high incidence that you are required to isolate for 10 days. Or quite frankly, you're not even allowed back in from some of them. So I'd have to look at the guidance, but I can send an answer to Justine when we're finished.
Excellent. Do you have a recommendation to, is it your recommendation to continue working from home if possible at this time?
Yes, I would recommend continuing to work from home if possible, and it all depends on your work site. I'm fortunate that in our office here, we have individual offices with doors, and we're pretty spaced out, and most people are out during the day anyway, inspecting and doing work. So it's not a crowded atmosphere, but not everybody has that. So I can work from both, but I do both. I think being away from others is important, particularly if you're there the whole day. I know we talk about 15 minutes within 6 feet, but if you're in a cubicle land, and even though you're greater than 6 feet apart, you're kind of sharing the same airspace all day. And I don't know what the research is on that, but it's got to have an impact on the possibility of getting COVID from a positive person. So you want to think about that, and it all depends on different circumstances within workplaces. But yeah, working from home is a good idea.
Okay. Next question. So Dubuque County and Dubuque were named red zones for COVID-19. What will be different with the designation, if anything, or is it just stay the course?
Well, first of all, the report, I only had a chance to look at the Iowa section, so it had a report on every state. I recommend everybody take a look at it, but I think it pointed out that we can't let our guard down, and this is serious. Iowa's having, an increased positivity rate, or the Dubuque County is, Dubuque, Polk, and Scott counties comprised of 37% of the state's cases over the last few weeks. So that's kind of a red flag that maybe says we're not doing everything we can to prevent the spread. All the things, whether it's mask wearing, physical distancing, hand washing, staying at home, avoiding crowds, limiting our trips to stores and retailers, all those things. There's not one thing that's going to fix this. You got to do everything. And so I think it's a wake-up call that we need to do more. And we know that in Iowa, the governor's proclamation is for the entire state, and local municipalities are not allowed to be more lenient or strict than those proclamations. So whether or not any policies are changed regarding some of our social mitigation strategies is up to the governor. But there was kind of a new recommendation, at least I haven't seen before, and that is that of recommending that only 25% of your time should be, outside with public interaction. So you should reduce your public interactions and activities to 25% of your normal activity. So that includes things like going to stores or restaurants, community events, those kinds of things. So basically it means we should probably stay home more.
Okay, thank you. Next question, just to clarify, a negative test before your 14 days have been completed, you still must complete the full 14 days.
Correct. You must complete the 14 days because you may still be incubating the virus and it may show up within that time frame.
Let's see. I believe that I'm not alone in misunderstanding testing. Previous to this, a negative test would immediately allow you to come out of quarantine. Can you reiterate that the exposure will require a minimum of 14 regardless of the test results? And I think that's what you just said as well.
Yeah, and as a backup to that, you know, go to that CDC link. The Iowa Department of Public Health has a similar messaging. And, you know, maybe it'll change. That's what we have to keep our eye on. But right now, that's the case. You cannot test your way out of quarantine.
That's a good way to phrase it.
Yep.
Can you talk about the antigen test?
Not much. Is that something Stacy or Patrice could talk about?
I see Stacy on here. Oh, go ahead.
This is Patrice. Can you hear me?
Oh, we can hear you.
Good. Our internet went down in the office right before this webinar started, so I just more or less jumped on not too long ago. But are you talking with the serology test? I can just briefly, and again, like Mary Rose said, I don't have a whole lot of information on it, but the serology test, I know that we have been informed that if you do indeed have antibodies that are present in your serology, then that basically means that you were exposed to the COVID. But what they're also saying is that they're doing research to see how long those antibodies will remain in your system. So even though you were to get a report that you do have antibodies, that you have been exposed to COVID, you should still never let your guard down because, again, they're doing research on how long that even remains in your system. And they are also doing research to see if you can be re-exposed with the antibodies present. So we don't know much, but I do know that there's still a lot of research going on with that.
And I'll try to address the antigen question specifically after we're finished here today. I'll do a little digging on that.
Okay, next question. Will the red zone announcement affect the return to learn plans for K through 12 and higher ed?
Well, I think K through 12 and higher ed are really working hard to try and zone in on their final plans. We met with the higher ed folks here in Dubuque County earlier this week. And the basic message is, you know, a lot of them have multiple plans or plans that can be modified, and that's pretty much what it's going to take. The K through 12 just received additional guidance from the state on that today that I haven't gotten through. I don't know that they have specific statistical markers they have to abide by to determine whether or not or how much they open, but it will factor in, and I think more especially after they open. So we're going to be working very closely with schools over the next week, and we have been advising them. I think the key is they'll have to be fluid and, you know, have multiple plans. I don't know specifically. This report, this White House Task Force report, is kind of a status report. I don't know that it doesn't come with requirements. It comes with recommendations and guidance. And I talked about some of those. So it's not any kind of a mandate. The federal government lets local and states define how they, what policies they set around individual sectors like schools.
Next question's about school as well. Is there any thoughts for how the county is looking to handle the possible spikes and required time off when schools are back in session?
Yeah, well, as Patrice and Stacy know, the schools are making plans for that right now. You know, some of the schools are going to have alternative days. I think the big unknown is that we really still don't know how infectious children will be if they get COVID-19, how sick they will be, you know, how much could they potentially or would they transmit it to teachers and staff at the schools, the older adults. That still remains to be seen. Hopefully, it will continue the way it is. I mean, right now, I think our 0 to 17-year-olds in Dubuque County are about 7 to 8% of all our cases. Hopefully, it won't get any higher than that, and the impact will be manageable. When schools reach certain absenteeism rates, it's usually the 10% mark. They report those to the county and the state, and then we work with them to determine best course of action and advise them on how they should be how they should proceed. There's really not a one size fits all, and I think Patrice has had a little more experience with that. Do you want to speak to that at all, Patrice?
Sure. Which aspect would you like me to touch on? I'm sorry.
Well, the 10% when schools report.
Oh, sure. In the past. Okay. Yeah. What we have done in the past is that if any school were to have a 10% absenteeism with the same like symptoms, then that is a reportable situation that has to go to the Iowa Department of Public Health. And currently the schools, what we see is the 10% that usually occurs during our influenza season. So the school usually contacts my office, and then there is a form that Iowa Department of Public Health requires that school to complete. And then once that's completed and submitted to IDPH, then we do come up with any plan that we can come up with for that situation. But again, we've been fortunate that it's only really the 10% absenteeism with the same like symptoms has only occurred during the influenza season. We've not had any other illness that I can recall that has presented itself that we would have to look at that being considered an outbreak situation. And we don't really know the definite percentage. I know that some percentages were mentioned of what we would need to be alarmed with pre-K through 12 and the higher education. So again, we'll be watching all of those like symptoms very, very closely, especially when the influenza season starts on top of the COVID event that's going on. So.
Looks like we've got about 3 more questions we'll try to quickly get through. Question, if an employee's spouse is exposed elsewhere but has no symptoms, should the employee and their spouse be quarantined?
Yeah, this is a question, and Stacy might want to chime in on this one. You know, how far secondary, tertiary, how far down the chain do you go in terms of these exposures? I was exposed to somebody that was exposed to somebody that was exposed. Well, you know, if you're living in the same household and you're living with an exposed person, it's probably best to, and they don't have symptoms yet and they're under quarantine, I would definitely separate as much as possible. Because if that person turns up positive and you have been separate that whole time, it's going to greatly reduce the chances that, you know, you may be positive too. Stacy, you want to add anything to that? You can unmute yourself.
Stacy was just sent an email. She was unable to attend, so Patrice is covering it for both of them.
Oh, okay. Do you have anything else to say on that one, Patrice?
No, I would just only add that Iowa Department of Public Health is doing our contact tracing, and maybe you had already mentioned that, Mary Rose. So they will ask specific questions of the exposure, the time, and the distance. And then we just follow those guidance of what's given. But nope, you included everything, Mary Rose.
So in that respect, it's a good idea to think ahead. And if you do live in, if your home is one that you could maybe plan ahead for to have separate sleeping accommodations, maybe a separate bathroom with not plenty of cleaning supplies to clean in between uses. So it's a good thing to plan ahead for if someone in your household does fall under that quarantine or isolation period, then you're ready. You're not caught off guard.
All right, 2 questions. This one's just a clarification. I'm confused. Is the antigen test and the antibody test the same?
No. I think Patrice didn't hear the first part of that question, Patrice. So I'm gonna get back to more information on that antigen test.
Okay, and
yes.
I answered on the serology antibody. I'm sorry. Sorry about that.
That's all right. We will direct you to the answer to the right person. Final question for today. I've heard a lot about new testing being developed that would get results faster and be less invasive. Do you believe that is the case?
Yeah, I think we're already seeing some saliva tests, some mouth swab tests. Those are being researched, and any kind of test for any kind of disease goes through a process to determine, how many times they get a false positive, how many times they get a false negative, and those are usually given out in what we call specificity and sensitivity and a percentage point. So as healthcare providers, they want tests that are the most specific and sensitive, like at a 95% level. So, we encourage our healthcare providers to use research-based validated tests. And, but I think we're going to see more on the market as we go. We have, already there is rapid tests that the hospitals are using for emergency and admission purposes. Sometimes they have to be backed up or confirmed or redone with a regular viral test. But yeah, there are a multitude of testing things out there. And as with all these new methods, the most accurate ones will rise to the top.
All right, excellent. I don't see any other new questions coming in. So Mary Rose, I thank you so much. Patrice, thanks so much for being on the call. If anybody has any follow-up questions, please direct them to the chamber. We will get them to the proper people. And Mary Rose will share her PowerPoint today with the chamber, and we can send that out to all our registrants. And please check early next week, and you will see a copy of today's webinar on the chamber website. So with that, thank you guys, and have a great rest of your Thursday.
Thanks, everybody.
Thank you.
Thank you, Mary Rose.
You're welcome.